and relax. Okay. So down at the core, not noting any abnormality there. See just a little bit of hip displacement here on this left side. It appears to be slightly lower. Any change of pain?
No.
Good. And we'll do the same with the left. Any change of pain?
No.
Okay. Just gonna lift your hair slightly here. Have a look at the back of the neck. Good. Just gonna adjust your top slightly here. Scapular indentation does not appear to be inhibited at all. Slightly warmer here at the carotid, but that's not particularly abnormal.
$99, $99, $99.
So I feel a nodule here. So I'm just going to mark that area. Good. Any pain there?
No.
And if you can do the same here. Any pain there?
No.
All right, Sandra, welcome to the office. My name is Dr. Perez. You are my first patient of the day, and it looks like I have you in for a quick sleep mask fitting, as you've been having some difficulty sleeping as well as difficulty with headaches. So I am going to go ahead and get you fitted for one of our Manta sleep masks today. Now, I'd like to thank Manta Sleep for sponsoring this portion of today's video as we move into your mask fitting. Manta is a longtime supporter of the channel, and we are happy to continue working with them at Siesta with Sarah. To begin with your customization, I have chosen the sound mask today, as you've stated that you typically watch ASMR videos while you sleep, but find that your regular earbuds are causing you headaches as well as interfering with your migraine piercing. So I believe this mask will be the best fit for you. Now, in order to customize it appropriately, I'm going to need to obtain a couple of measurements, as all of Manta Sleep masks are fully adjustable. So I am going to begin by measuring the distance between the corner of your eye and your ear. So right at about 3.5 inches there. Now, the purpose of these measurements is to allow me to adjust the Bluetooth component of the mask appropriately. So, and we're actually about 4 inches on the right side. So I'm going to go ahead and measure the circumference of your head right above your eyes. So keep your eyes closed for me. We're right at about 22.25 there. Okay. So I am going to apply those measurements to the mask itself. From the edge of the C-shaped cup to the Bluetooth component, you were right at about 4 inches. So I'm just going to adjust that slightly. Now on the left side, we were about 3.5 inches, so I'll go ahead and adjust that as well. And as far as head circumference, I had you at about 22.25. Perfect. So I can go ahead and mark that, and I will adjust that accordingly. Now, lastly, for measurements, I am going to use my arch ruler here to just measure the curvature of the eye so I can place the eye cups in the appropriate position. So we are at about a 1 there. And on the left side, I would say we're about a 3/4 there, slightly short of the 1. Okay. So the left side I'll go ahead and adjust for you. And the right side, we should be okay. Alright, so let's go ahead and trial your mask. Now, as stated, this is the Manta sound mask with the tapered C-shaped cups. So I'm going to go ahead and adjust here at the back and just ensuring that the Bluetooth component is in fact in line with your ear, which it is. Okay, so just having a peek at the front here. I am noting an appropriate fit. Now, one feature I'd like to note about the sound mask in particular is the breathable fabric. So I find that the mesh-like material allows for proper air circulation, prevents overheating of the eye and forehead areas, and the C-shaped cups allow for comfort for side sleepers. Now, you have stated that you prefer to sleep on your side, so I find that this is a feature that is quite comfortable. I myself am a side sleeper, so I can definitely attest to that. Now, one feature I would like to test out to ensure that we are in fact getting a proper fit is the blackout component. So I'm just going to shine a light here at the top of the eye cup. As well as at the bottom. And lastly at the bridge of the nose. Okay. Now I do find that we have an appropriate fit here for you. So lastly, you stated that you quite enjoy aromatherapy and that it helps you sleep. So a secondary product that I would like to recommend are the Manta Aroma Dots. Now I find that these are quite relaxing and easy to work with, as they come with a Velcro applicator to apply directly inside the mask. So I personally favor both the bergamot and the eucalyptus. However, today I will be demonstrating with the bergamot. Just apply the Velcro applicator and place it directly inside the mask. Now you can place this wherever you like. I tend to favor the space between the bridge of the nose. And of course, lastly, the Bluetooth component, which we would then turn on, and you should hear the intro to my channel. Very good. Okay. All right, Sandra, I would like to thank you for coming in for your mask fitting today. I will go ahead and package this in the Manta Sleep carrying case that comes with every mask. And I would like to remind my audience that they can use code SIESTA for 10% off their purchase at Manta Sleep on any of the products I've shown today, as well as any products on the Manta Sleep website. And that code can be found both in the description box and in the pinned comment of this video. Sandra, thank you very much for your time. I hope you get to feeling better. I will I'll allow you a couple of minutes to rest here while I package your mask and await my second patient. Thank you. Hi, Brittany.
Hello.
Welcome to the office. It's nice to have you in today. It's also very nice to meet you. I got you in as a referral this morning, so it looks like your primary care physician sent you over due to a recent back injury or back pain.
Yeah, I was working out at the gym a few days ago. I was deadlifting, and I just have noticed some lower back pain,
Lower back pain, okay.
mid to lower back pain. And it's been about 4 or 5 days, so I wanted to get it checked out.
So 4 to 5 days since the onset of the injury.
Mm-hmm.
Okay. And you said you were lifting weights?
Mm-hmm.
Lifting weights. Is that something you do frequently?
Yes.
Okay. All right. And you said the pain is mid to lower back, so about here?
Yes.
Okay. All right, so I'll just take note of that. Now, you said the injury took place about 4 or 5 days ago. Did you notice immediate pain? Was there any, like, obvious signs of injury, any popping or anything?
Not immediately. No.
So nothing right away. Was it, like, the next day that you started to feel soreness?
Yeah, at first I thought it was just a sore muscle, and then as the day kind of went on, it just feels very strained, and I haven't noticed any improvement since then.
So if I could have you rate the initial pain about 4 days ago, on a scale of 1 to 10, what would you say it was?
Probably about a 5 or a 6.
5 or a 6. So moderate to severe pain. Now today, it's been about 5 days. Has the pain gone away at all? Has it gotten worse?
Hasn't gotten worse, but it hasn't gone away. It's just been the same.
So you're still at about a 5 or a 6?
Yes.
Okay. Is there anything that makes the pain any worse, like raising your arms above your head, bending over?
Bending over a little bit.
Bending over?
Mm-hmm.
Okay. Have you continued to lift weights since the onset of the injury?
Yes, but not using my lower back or my legs.
All right, well, that's very good to note. Now, you said you lift weights regularly. You appear to be pretty physically fit. Is that a normal, like, workout routine? Were you doing anything different that day? Was that a new, do you usually deadlift?
I deadlift about once a week.
Okay.
Mm-hmm.
Do you remember how much weight you were lifting at the time?
About 60 pounds.
60 pounds. And is that normal for you, or is that heavier than your normal?
It's a little bit heavier than
A little
normal.
bit heavier? Did you notice any issues with your posture? Was there anything different about your stance?
No.
Not really?
No.
Okay. All right. Have you ever had any previous back injuries or injuries while working out?
No.
So not typically prone to injury. Okay. Now you said the pain was kind of mid to lower back. Any radiation of pain up towards the shoulder, towards the scapula, or down towards the tailbone at all?
Down towards my tailbone a little
Down
bit.
towards your tailbone. Okay. Any pain in the upper extremities, arm pain, neck pain?
No.
Any pain in your feet by chance? No.
No.
Okay. All right. So I am going to go ahead and get started with my initial assessment. At this point, I'm not particularly concerned that it's anything obviously broken or dislocated, as you're able to walk. Your gait looked normal when you were walking into the office. I'm not noticing any wasting or atrophy just standing here. I do see maybe just a little bit of misalignment at that left side. You seem to be leaning just slightly. Are you left or right hand dominant?
I'm right dominant.
Right dominant, okay. All right, so I'm just gonna get a light and have a bit of a look, kind of externally looking for any abnormality in bone structure or just muscle wasting, anything that looks asymmetrical. Okay. So I want you to sit just in your regular, like, relaxed posture for me. So I'm just gonna come around the front here and just wanna have a look at your whole body stance, looking for any signs of asymmetry there, and down at the core, not noting any abnormality there. See just a little bit of hip displacement here on this left side. It appears to be slightly lower. Are you having any pain in your hip?
Sometimes at the gym, but it doesn't seem like related to any injury, just general.
Just a little sore?
Mm-hmm.
Okay. Okay, so I'm going to have you perform a couple mobility tests for me so I can assess whether or not there are any abnormalities in your flexibility, mobility going forward. So I'm going to have you sit all the way up for me, very upright position, kind of hyperextending the back there. Any pain at the lower back?
A little bit.
A little bit, okay. So I'm going to have you maintain this posture for me, and we're going to raise your hand here. Any excess pain there?
No.
No. If you could do the same with the left for me. Any excess pain there?
No.
Okay. Good. Are you able to bring your hand behind your back for me? Any change of pain?
No.
Good. And we'll do the same with the left. Any change of pain?
No.
Okay. I'm going to have you perform a twisting motion at the upper body. So we're going to keep your hips parallel here, and I'm going to have you just twist at the top for me. Any pain there?
No.
No. And we'll do the same coming this way. Any excess pain there?
No.
Good. Okay. So I would like you to lean forward at the pelvis. So bend forward towards your knee for me. Is that uncomfortable or painful at all?
Slightly.
Slightly. Okay. And are you able to go forward any further, or is that about where it starts to hurt?
That's where it kind of starts to hurt.
Okay. Now if I palpate down the spine here, can you tell me to stop when you feel the most pain?
About right there.
Right here. Okay, you can go ahead and come back forward. Just going to take a mental note of that. So just under the rib cage there. Okay. All right, so I'm going to have you try to squeeze my hand with your shoulder blades here. So very good. Any excess pain there?
No.
And if you could shrug at the shoulder. Anything there?
No.
Good. Okay. All right. So I'm just going to check a couple of these bony prominences here for any signs of temperature abnormality. So just using my thermometer gun to test at the clavicle as well as the shoulder. Essentially looking for any signs of inflammation. If any areas are particularly warmer than normal, it could be an indication of injury. So just slightly warmer here at the carotid, but that's not particularly abnormal. Any illnesses recently? Cold, flu?
No.
Going to come around and do the same on the left side. Good. Okay. So average body temperature of about 97.2, which is good. Slightly lower at the lower extremity. Your legs are quite cold. Do you tend to have any issues with circulation?
I don't know, but I do notice my legs get cold very easily.
Okay. Legs and feet, or just legs?
Legs and feet.
Okay. What about your hands?
No, my hands are normally warm.
Okay. So likely unrelated, I do notice quite a drop in temperature starting at about the knee. Have you ever seen a specialist for that, like a vascular doctor or anything?
No.
Okay. All right. All right, Brittany, so we can go ahead and move on to just a couple of measurements here. I just want to measure mostly for symmetry at the upper body. So if there was anything, kind of a more significant injury that could have affected your body symmetry or any wasting. I do see just a little bit there at that left hip, which I will have a look at in a minute. So I'm going to have you extend your arm out for me. Okay, go ahead and relax. Okay. 6. Okay, so you said you are right-handed. How tall are you?
5'7".
5'7". Okay. So I'll have you extend your hand out for me. Slightly shorter here. Okay, that's okay. Go ahead and lower. So your left arm is about a 1/4 inch shorter than your right, but that is completely normal.
Okay.
Okay. So aside from the pain, Brittany, did you or have you experienced any other symptoms, any loss of sensation anywhere, specifically in your back or upper extremities?
No.
Any tingling or like a pins and needle feeling, like a static feeling?
No.
No. Good. Okay. And no issue with hand strength, grip strength since the injury?
No.
No. Good. Okay. All right. So I'm going to take my calipers and these are very cold. I do apologize. I'm just going to have a look here at this one area. I want to make sure that there's no signs of atrophy here. So if I could have you extend your arm up for me. Good. Now if I hold this point here and manipulate your arm, any excess pain there?
No.
And here?
No.
And here?
No.
Good. Okay, very good. All right, so same thing on this side. I'm just going to have a look here. Okay. Good, and I'll have you extend this arm for me. Perfect. Okay. Now same thing, if I hold this point here, any excess pain as we manipulate?
No.
Okay, so I do feel some slight hypermobility. Oop, okay, so I heard a pop there.
It does that sometimes.
Okay. Does that typically only happen on the left side?
Yeah. It doesn't hurt. It just...
You just notice the sound?
Yeah.
Okay. All right, so I am going to just have a look at you from the anterior side for a second. So if I could have you kind of slouch, like an extra slouch. Very good. Okay, and then I'm going to have you sit up. Very good. So your posture is fairly even, not noting any abnormality at the midsection there, and scapular indentation is even. I'm going to have you shrug your shoulders for me. Good, and relax. I'm going to place my hand between your shoulder blades. I'd like you to attempt to squeeze my hand. So we're going to bring your shoulder blades together. Any excess pain there?
No.
And if you do the opposite and bring your breastbone together, any excess pain there?
No.
Okay. Very good. All right, so lastly for mobility, I'm going to have you lean forward at the pelvic bone. So just lean towards your knees. Any excess pain there?
A little bit in my lower back.
Lower back, so tell me where it's the most painful.
About right there, yeah.
About right there. Okay, so I'm just going to make a note of that. You can go ahead and relax for me. All right. Okay, so I'd say your mobility is at about 95%, slightly impaired at the bending over, but you did say that that has become painful for you.
Mm-hmm.
No issues with mobility of the upper extremity though, which is good. And I did hear some hyperextension on the left. just want to document that 1/4 inch difference. I don't think it's anything significant. I just like to have it in case we have you back for a follow-up. We'll redo measurements and see if there's any changes. All right. So I just have a different kind of ruler here. I'm just going to have a look at the clavicular area. So just have you sit normally for me. So this just allows me to look at the angles of the bone structure. There are several markers here that kind of in line with your natural bone structure. So for midline, the thyroid, parallel to the ear, and we're about even with the end of the clavicle there, so that's a good sign. Now, do you lift weights for like any professional reasons? Are you a personal trainer or just for natural health reasons?
Just for natural health reasons. Okay. I do compete sometimes.
Do you? Okay.
Mm-hmm.
Do you find that you ever have any issues with muscle recovery?
No.
Okay.
I am very flexible though, so sometimes I have to recorrect my form because...
Okay, so to maintain proper posture?
Yeah. I notice I will easily hurt myself if I don't correct it.
So it's definitely good that you're aware of it. So sometimes hypermobility can affect your posture and body mechanics with weightlifting, especially if you need to maintain that rigidity. So something to keep an eye on for sure. Okay, so I think what I'm going to have you do is turn around on the table for me so that I can have a better look at your back. Do a couple different assessments there. Take some more measurements. I'm going to redo your temperature testing, and then I have a couple of reflex tests that I want to do to see if there's anything going on like in between your vertebrae. So you'll feel me do some tapping with a hammer. It shouldn't cause you any pain, obviously. If it does, you can let me know. Okay. So go ahead and turn around for me. All right, Brittany, so coming in here with my Penlight, just going to re-perform my visual assessment this time on your back. So just going to lift your hair slightly here. Have a look at the back of the neck. Good. Elbows are fairly well aligned. Give you some slight distension here on the left. Brittany, would you say that one side hurts slightly more than the other? Is it about even?
My left hurts a little bit more.
Left hurts a little bit more? Okay. So I do see some mild distension here in comparison to the right side. So I'm going to take a couple of measurements of your back. So just maintain your natural position for me to start with. I'm going to start here on the left side. So I'm just going to use your shorts as a marker to measure. So about 17.5 inches there, level to the scapula. I'm going to have you perform the same test where you squeeze your shoulder blades together for me. So I'm just going to measure that indentation is about 4 inches. Okay, go ahead and relax. Very good, so even distribution there. Now I do see some mild distension here at the left lower back. I'm going to retest with my thermometer gun here and see if we are seeing any signs of temperature variation, which is not notable. So that's a good sign that it's not particularly inflamed, maybe just a little bit of swelling. Sometimes if we have an injury, our body will swell with fluid just to kind of protect the area and promote healing. So I'm going to palpate around and I want you to let me know if any part of this is particularly painful or if when I switch to the other side it feels different. Okay? So I'm going to start by palpating here on the left side. Just going to adjust your top slightly here. Scapular indentation does not appear to be inhibited at all. So I'm just going to move your shoulder here slightly. Any pain with that?
No.
No, good. Okay. So I'm going to do directly across the spine now, and obviously you're feeling pain here. I'd like you to tell me to stop or pinpoint the exact position where it hurts the most. So just trying to isolate pain here.
About there.
Out there. Okay. So I'm just going to mark that with my hand. I have a very small reflex hammer here. I'm going to do a light percussion. Is that painful?
A little bit.
A little bit. If I come up slightly, still painful?
Not as much.
And if we do down slightly, is that still painful?
Yeah, that is.
Yeah. Is it, okay, so this point is the most painful. Can you tell me at what point it stops hurting downwards?
About there.
About there. So right at about the tailbone there. And coming upwards, at what point does it stop hurting?
About there.
Okay. So I'm just going to mark that point there. So we've got about a 4-inch section laterally. Now, if I come, so the most painful point is here. I'm going to come towards me. Does that still hurt?
Mm-hmm.
It does. Can you tell me when it stops hurting?
About there.
Okay. And if we go in the opposite direction, does that still hurt?
Not as much,
Not
no.
as much. Okay, so definitely a difference here on that left side. So I'm going to have you bend forward for me. I only want you to go up until it doesn't, it's not like excruciating pain. So does that feel okay?
Mm-hmm.
Okay. So I'm going to feel directly along the spine. Okay. I'm just feeling the individual vertebrae, feeling for any signs of distension between the discs of the spine. So okay, Brittany, you can go ahead and relax for me. Okay, so I'm going to go in with a bigger reflex hammer. Now I'm going to feel some light percussion. Just listening for any audible differences at the bony prominence. So as I percuss directly over the bone, sounds slightly different as I come down towards the more dense areas here, so that's good. Any pain along the rib cage here at the back?
Not too much, no.
Okay. Good. And on the right side, any pain along the rib cage?
No.
Good. Okay. do a little bit of bone conduction testing. So this is going to produce a very slight vibration. So let me just give you an example. You should feel vibrating here on your bony prominence. I want you to just tell me if it feels differently on either side. Okay. So essentially just testing to see if there's any issues with your neurological function bilaterally. So because you're having pain more isolated to the one side, I want to make sure that it's not so far penetrated into the muscle that it's affecting your neurological function. So if I start here, you should feel it equally on both sides. Do you feel any difference there?
No.
Good. So this sensation compared to this sensation, does that feel about the same?
Yes.
Good. And here, did that feel the same?
Yes.
Okay. You feel vibration here?
Mm-hmm.
Does that feel the same?
Oh, no.
No, good, okay. And here versus here, about the same?
About the same.
Good. And here versus here, is that about the same?
Mm-hmm.
Very good. This one might tickle just a little bit. Here at the elbow. Is that about the same?
Mm-hmm.
Good, okay. So bilateral sensation appears to be intact. I am going to touch your back with this pointer stick. I'd like you to just say 99 if and when you feel something, okay?
99, 99, 99, 99, 99, 99, 99.
Good. And any difference in sensation bilaterally? So does that feel any different than that?
No.
That or that?
Mm-mm.
And then, of course, directly over the pain area here, does this feel any different than this?
No, not really.
No. Okay, good. All right. So I have an acupressure tool here. It's spring-loaded. So I'm going to use this directly on the painful area. Now, it might cause you just a little bit of discomfort. Shouldn't necessarily feel painful, but if the injury is what I'm suspecting, then this might alleviate some of the inflammation. That should actually help alleviate the pain. So I'm just going to use this here. Is that painful at all?
No.
Do you feel any tenderness or pressure?
A little tenderness.
A little tenderness, okay. So essentially just encouraging the excess fluid here to kind of drain laterally so that it comes down and away towards your hip and away from the spine, which will allow for some decompression, because I am seeing a little bit of inflammation here at the spine where you're kind of producing excess fluid in order to heal the injury. So just some light acupressure here, help encourage that lymphatic drainage and hopefully alleviate some of the discomfort. Now, since the onset of the injury, have you taken anything for pain? Any over-the-counters?
Some ibuprofen.
Did you feel like it helped at all?
A little bit.
Okay. So I feel a nodule here. So I'm just going to mark that area. So I have another tool here. I'm just going to give you an example so it doesn't startle you. Now it is fairly sharp. It's not going to cause you any pain. It's going to kind of work similar to microneedling if you've heard of that. So it's just going to encourage blood flow to the surface of the skin. So I'm just going to manipulate this area very slightly. Does this cause you any pain?
No.
No, okay. So I am going to move in a grid pattern here. So just encouraging blood flow to the area, allowing your body to kind of heal itself naturally without any excess manipulation. So this will just help bring a little bit of blood to the surface, which will help with muscle repair. So I'm just going to move in all directions here. Do you have a foam roller at home?
No, I don't.
Okay. So I would recommend obtaining one if you can. You can pick them up like at Target, or I think they even carry them at GNC or whatever your regular like nutrition store is. They also have them at the gym, likely at the gym store if you just buy one there. I don't want you to roll your back. I would like you to roll your hips though, because it will help with some of that displacement, specifically on the left side. So it does look like a little bit of that swelling has gone down. Now while I'm here, I'm gonna have you twist towards me. Does that feel any different than it did initially?
Yeah.
A little bit? Okay. Let's go ahead and relax. Okay. So similar to the microneedling, I'm just agitating the surface of the skin, essentially encouraging that blood flow. So you might see a little bit of discoloration in this area. That's totally normal. So some people say it looks like a hickey. You're going to see little dots. That's totally fine. It's just a capillary reaction, and that will go away within a couple of days. Sometimes the area might even feel slightly bruised. It's just due to the manipulation, and all of that is totally normal. Just going to pull the skin taut here. Is this painful at all?
No.
Good. Okay. Can you tell me if this feels about the same as your initial 5 to 6 on that pain scale? Any worse, any better?
It's gone down a little bit.
Gone down a little bit? Okay, very good. All right, Brittany, I am going to have you turn back around on the table for me if you don't mind. Okay, good. And then I'll just have you scoot your bottom for me to the very edge of the table there.
Okay. Like this way or back?
Back towards, yep, perfect. Okay, so I just want to have a look at your lower extremity just briefly, just to make sure. I would hate to have you leave and then you end up having some secondary knee pain. A lot of times back pain is actually related to the lower extremity, so whether it's poor body mechanics or improper footwear, it can all affect our spine essentially. So just want to have a look here at the knee. Now your legs are still very cold. And no pain with the lower extremity joints, correct?
No.
Good, okay. So obviously you have socks on. I'm just gonna feel around here slightly. Okay, so I'm gonna support your back here. Are you able to bring your knee up just a little bit? Good, any pain there?
No.
And if you could do the same here? Any pain there?
No.
Very good, okay. You can go ahead and scoot forward in a position that's comfortable for you. just document a couple of things here. So let's see. So there was some slight distension there on that left side, so just a little bit of swelling. You've got about a 2 by 2 inch section on the left where it is a little bit swollen. It does appear that it's mostly fluid. It's not like your vertebrae in your spine is inflamed or that there's any dislocation of the disc. So I would say that it's likely you're just positioning maybe was slightly off. So when you were lifting, you just tweak the muscle a little bit, so it's just a little bit swollen. My recommendation moving forward, it's been about 5 days since the onset of the injury. Obviously, you are typically pretty physically active. So I would say give it about another 3 days if you can. Obviously, at that point, if you're not feeling any pain at all and you're feeling better, you can proceed with caution. So go back to your normal routine, just maybe take it a little slow. Maybe a little bit lighter of a weight, since you said 60 was on the heavier side for you, just for the next week or so to get started. If the pain gets any worse or you find that you're having trouble with your mobility, bending over becomes excruciatingly painful, you're no longer able to lift anything, or your normal day-to-day physical activity becomes difficult, then I would like you to come back in.
Okay.
Okay? All right. So, did you want me to put any medication in for you as far as pain medication? Do you feel like you need it at this time? Anything topical?
I think the ibuprofen has been
Helping?
working, yeah.
Okay. So obviously with that, you just want to make sure you're maintaining proper hydration, drink your water, and I wouldn't recommend taking it on an empty stomach, but other than that, you should be fine.
Okay.
Okay, all right. Well, I'm going to go ahead and get all of this documented as well as your measurements, put everything in, and they will be in file for you should you need to come back. That way we can redo your measurements and see if there's any changes.
Okay, thank you.
Well, thank you so much, Brittany. I hope you feel better soon.